Hi, and welcome to the Spawdcast. My name's Carrie Hyde, and I'm your host, and I'm your pet's life coach. Today on the show, we're going to be talking about IBD, irritable bowel disease. So if you've ever had a pet who has woke you up at 2 o'clock in the morning to go potty, or God forbid you've had to clean your carpet at 2 o'clock in the morning, this is going to be the episode you're going to want to listen to. So before I introduce our expert guest, I'd like to actually introduce you to a friend of mine who also is a client of mine. So welcome to the show, Miriam Gelfand. Hi, how are you?
Hi. Good.
Good.
Thank you.
So Miriam was a guest, or a client of mine, and then we just became friends because we have mutual interests, and she is a huge animal lover. So before we introduce our expert, Miriam, tell us a little bit about why you wanted to be here, why you want to interview our guest.
Well, I have one dog now. I just recently put down my other one, Choo Choo, and we love Choo Choo. He was a really great dog. He was my first geriatric dog, and I really watched how his life, I had him from 10 to 15 and a half, and I watched how his life went and the decline, and was thinking, what can we do to prevent some of the things he was dealing with?
Right.
And then my other dog has always had allergies and things like that, and little digestive issues, and so I was very, very interested in the subject.
Yeah. So as you know, I always bring on a guest host because they can help me answer or ask questions to our experts that maybe I don't think about, just because I've been doing it for a long time. So Miriam, I can't thank you enough for being here, helping us interview. But without further ado, I am so very, very excited to introduce to you someone that I have wanted to work with all the way back since I met her in Chicago a few years back. She was actually, for most of you, you know that we were going to be doing a live show. She was going to be on live stage with us. But now I've got her here in our studio on a big, giant, widescreen to talk to us. So without further ado, I'd like to introduce to you one of my favorite veterinarians in this country, Dr. Odette Suter. Dr. Suter, hi, how are you?
Hi, I'm good. How are you, Carrie and Miriam? And thanks for the introduction. It certainly was a pleasure meeting you in Chicago, and I'm glad that we are finally getting together, even though it's just virtual. It's still It's awesome.
It's working.
Thanks for having me.
It's awesome. It's awesome. I met Dr. Suter in Chicago at a convention for Dogs Naturally magazine. They put on this big convention every year, and they talk with holistic veterinarians, which Dr. Suter is. So it was just an awesome convention, and it was kind of like where we all got together and just kind of learned about different stuff. So when I spoke with Dr. Suter about putting her on the show, I always ask the veterinarians, what subjects do you want to talk about? And so we kind of communicated a little bit, and we know that IBD is a really big issue with both our cats and dogs, and so that's what we settled on. So Dr. Suter, can you just tell us a little bit about how you got into veterinary medicine and what led you into holistic veterinarian?
Well, how I got into it was, I was a very avid horse, I was a horse fanatic as a teenager. So that's how I got exposed to different veterinarians who would come to the barn and, treat the horses and so on. And there was one case where the horse had fallen on its, knees. Well, it's not the knees, it's really the carpi, when I was out with him. And so he needed some stitches to repair those, and the veterinarian who was there helped, he explained everything to me, and I got really interested, and I don't know, for some reason I knew then that I was going to become a veterinarian.
That's amazing.
And then holistically, I got into it because all I saw in veterinary medicine, and human medicine as well, was that, we use antibiotics, we use steroids, and we use pain medication, or we do surgery. And, it's just like these four choices. And I'm like, oh, that can't be it. Plus, my patients would come back with the same things over and over again. And I'm like, well, obviously that's not healing anything. So that definitely, got me more into holistic medicine. But it started even, before that. My mom was more into herbs, and we had our organic garden, and we were kind of eating with whatever nature was providing, type of thing. And then I met other people who were more interested in holistic medicine and just opened my mind to different things. So I really became a little bit of the pain in the butt for my professors in vet school because I would ask very uncomfortable questions. I mean, for them uncomfortable because I wanted to know why and what we can do, rather than just say, well, we have, like in the case with of IBD, we know we just have chronic inflammation, but why?
Right.
Why is that?
So what?
Just kept asking questions. So that's how I got into it.
What veterinarian school did you go to?
I went to veterinary school in Bern, Switzerland.
In Switzerland, yeah, that's
Yeah.
interesting. Do you find that the schools in Switzerland are similar to the schools in the United States, or do you think there's some differences there?
Well, there's definitely a lot of change that has happened since I graduated, so it's hard for me to be able to compare. But when I went to vet school in Switzerland, we didn't really have a lot of clinical time, not as much as they have here in their fourth year, where they're basically just in the clinic a whole year. But I'm sure that's changed since then as well.
Is it still 4 years in Switzerland, or is it longer or shorter?
Well, in Switzerland, it's 5 years, but we don't have the undergraduate like it is here. So the first year of vet school is basically sciences. Biology, physics, chemistry, and a little bit of anatomy and biochemistry. And then we start with a, veterinary curriculum, really. So the first year I actually studied at a different, university that didn't have a veterinary curriculum. So the first year is basically with all the med students well, with the dentists and everything. So it's a bit different, it's just a different structure.
So when you came to the United States, what did you do to get licensed here in the US? Did you have to do more schooling? How does that happen?
I did have to go through a little bit more schooling, just because I was very stubborn when I first came, and I'm like, I'm licensed in Switzerland. What do these Americans think? That I have to get relicensed again, and they wanted me to jump through a bunch of hoops, which I eventually did, but because I had taken a good break, I had forgotten a lot of things. So I went back to vet school for 6 months, with a curriculum that they offer specifically for people from other countries, to prepare for the exam.
Yeah.
Which is quite grueling, the exam itself. So anyway.
The exam.
But thank God that's over with.
So how long have you been practicing veterinary medicine in the United States?
Well, I graduated in '94, and I've been practicing in this country for 15 years or something. It's hard. I can't remember.
That's amazing. That's amazing. So let's kind of start talking a little bit about IBD. Can you do you see? Well, let's back up a little bit and let's explain the difference between IBD and IBS. Right. So there's a difference. A lot of times people ask me what that is. So can you explain that to us?
Well, I mean, in veterinary medicine, we tend to use a little bit more of the IBD, and it's also kind of changed a little bit to using a different term, which is chronic enteropathy, which would include more things because, IBD, IBS, chronic enteropathy, whatever you want to call it, it's just a description that something is going on with the GI tract, with the gastrointestinal tract. It's a bit like the engine light in the car. It just comes on and you see the engine light, but it doesn't tell you anymore.
Right.
Because then you have to do the diagnostics and find out what's going on with the car. So IBD, IBS, whatever you want to call it, is just really basically the car engine light that came on, and then you have to figure it out.
Okay. So when we talk about IBD, irritable bowel disease, a lot of times I think the word disease makes people think that it is, just like a cancer, like you can't prevent it, those kind of things. Do you see a lot of IBD in your practice?
Yeah, all the time. Yeah, all the time. And it shows up in very different ways, like a dog that keeps burping, for example, chronic intermittent vomiting, lip licking. It doesn't even have to be diarrhea per se,
right.
or Yeah, so it can be all sorts of other signs, if they're not gaining weight properly, if they're really picky eaters, those types of symptoms, they can all be related, or they can all, signify that there is an inflammatory process going on in the GI tract.
Okay. So I think that's important for everybody to know, if they understood correctly, that there's a lot of symptoms to IBD. So,
Yeah.
I have clients come into me all the time that say that their dogs are burping, those kind of things are happening. And so that's all connected within the GI tract, correct?
Yeah,
Okay.
yeah, like, cats that are so picky, or the small dogs that don't want to eat their food, that have to be force fed. I just saw a couple of dogs yesterday where the owner is basically force feeding them, and I'm like, no, let's not do that. Let's figure out what's going on so that they will want to, enjoy their food again, and
So the dog just didn't want to eat?
yeah, both dogs, they're not eating, although they're in good weight and happy otherwise. So I think a lot of it is also, well, we can't forget the component of the human that comes along with the animal,
Right.
If you have somebody who's constantly stressed, their animals will pick up on that. And stress affects the GI tract, it affects the nervous system, and then it affects the microbiome. So it affects everything, so we can't really separate these things.
So what do you think? Like, we get these puppies and they seemingly are super happy and healthy, and we get them home and we play with them, and within a week we've got diarrhea and we rush to the vet and the vet does their treatment. What do you think is the cause of, like, I know there's lots of causes, but what would you, if someone had to say, listen, I think if we got rid of this, IBD would go down. What do you think is one of the causes that as pet owners we can help prevent our pets from getting IBD?
Yeah, there's no one thing.
Right.
But usually, puppies, they are a little bit more prone to catching some sort of a little bit of a bug. And, well, actually, there is the one thing, is the rushing to using drugs as soon as there's a little bit of diarrhea.
Yeah.
I think, if I could narrow it down to one, it would be metronidazole or Thailand.
Yeah.
Because the thing is that anytime an animal has diarrhea or a fever, we think there's something wrong. We have to cut down on the symptom, right? So we don't let them have diarrhea, because diarrhea is one way for the body to get rid of things. Okay?
Right.
So if a puppy gets diarrhea, well, maybe it caught a little bug somewhere or something, or ate something it shouldn't have. It needs to have diarrhea in order to flush the system out. So diarrhea is a way for the body to get rid of things. Okay?
Right.
Just like a fever is a way for the body to basically burn whatever virus is there to death, so that it will disappear and get cleaned out. So what we do in medicine in general, conventional medicine, not just for animals but for humans as well, we don't even let the bodies have symptoms to clean itself out, to heal itself. We go in there with drugs and anti-inflammatories and steroids and you name it, to just cut down on the symptoms. And that's basically like taking a piece of duct tape and putting it onto your car engine light, on your dashboard. Yeah, you don't see it anymore. Maybe it resolved, but what's happening to your engine? You didn't fix anything, right?
Oh my gosh.
You just suppressed whatever symptom is there. And I think that's probably the most common and probably the most detrimental thing that we can do, is to suppress symptoms.
Oh my gosh.
Obviously, if an animal is so sick that you have to worry about them dying, that's a different story. But if a dog, an adult dog, gets a little bit of diarrhea, put them on a bland diet for a few days and see what happens, rather than rushing to the vet. And I'm not saying you shouldn't rush to the vet, but I think we just need to go back to a little bit of basics, and just try certain things first before we go for the drugs. And metronidazole in this country is used like
candy.
Tic Tac.
It
like
is
candy. It's just crazy, because in European countries it's not even on the market much, So
Right. Right.
It's just crazy. For any little bit of diarrhea, every dog gets metronidazole, and there was just a recent study that came out on metronidazole that basically decimates the microbiome. And
Yeah.
it doesn't recover very quickly. So 4 weeks later, you still have a microbiome that has not recovered
Right.
from it. So it creates imbalances, and then down the road, things just get worse and worse, you know, to the point where then, you know, the diarrhea continues and keeps recurring, and then other GI signs will show up, like vomiting and lip licking and, you know, trying to eat inanimate objects and, you know, all sorts of things. And, you know, one of my favorite is, you know, people who worry about their dogs eating poop. I'm like, well, that's a sign that there's an imbalance there, and your dog is just trying to remodel its own, you know, GI tract. And so, you know, when I do, you know, poop is one of my favorite subjects because there's a lot of, you know, it's very therapeutic. So I got a T-shirt, and I don't know if you guys can read it.
Yeah. My dog only eats organic treats. Pull it up just a little bit higher. And his own poop. That's amazing. I got to get that T-shirt.
And I need that T-shirt. Yeah.
If a dog eats poop, then it is because they're not getting the microbes. You know, they're trying to replenish their own microbes in the gut. Or there's something not right. And then, you know, of course, down the road, you know, dogs kind of develop a bit of a taste for it, so they will just continue with it. But, you know, if any dog eats poop, it's a very natural thing. I mean, in the world of animals, they eat each other's poops. Like, for example, foals, as they start to eat more of the, you know, roughage like grass and hay and things like that, they will start to eat some of the other horses' poop to colonize their own microbiome, their own GI tract, to have more, you know, more of the microbes that they need to digest food. So, sorry,
you're fine.
Choking on my own saliva. So, anyways. It's a natural thing. Obviously, we humans find it very disgusting.
Right.
Especially because, you know, then they come and lick our face, blah, blah, you know. It's really gross. I understand that. But I think we need to look at it with a little bit of, you know, from a different perspective, that the animal is just showing us something and that we need to pay attention.
Yeah, I see so many dogs come into my boarding facility, and I have to look over their paperwork. Of course, I have to look and make sure they've had their rabies vaccines and stuff. And I can tell just from the first 2 vet visits where this dog is going to lead down. And most always starts with metronidazole on their paperwork. I'll see it on there. And the thing is when you get a dog and you take him away from his home and put them into a new environment, right, they're going to get a little nervous tummy. And sometimes they get a little diarrhea, and then they rush to the vet. I see it all the time. They rush to the vet, and there it is, metronidazole, and then on top of that, a whole bunch of other stuff. And I just think, well, there goes the microbiome. The gut is going to be destroyed for this dog for the rest of his life if we don't fix it now. But it just becomes this, you know, I got the diarrhea, now I got the metronidazole, now I'm going to eat poor diet, then I'm going to get more diarrhea, more metronidazole, and it goes on and on and on and on until the gut is destroyed. And you only have this dog that lives, you know, 12, 13, 14, 15 years. Hopefully we're going to extend this. That's why the show is here. But you're exactly right. And I'm glad we agreed on that, because that is one drug I have been saying forever. Please, please, please be careful and not just continue on to that. So one day, hopefully that will stop. Because there's a lot of things, you know. I tell my clients, I'm not a veterinarian, but when they do ask me, I say, you know, maybe do bone broth for a day and let's see what happens and see if it'll resolve itself. But I think it's important for our listeners to know that I don't think Dr. Suter is saying you don't ever have to go to the vet. It's just watch the symptoms, right? Because they'll progress if it's something more serious, right?
Yeah. Yeah, no, I'm not saying not going to the vet. I mean, especially in a puppy, when they have diarrhea, you want to be careful because they go down the drain very quickly.
Right.
You know, they don't have the reserve. So, if your puppy is not playing, it's lethargic, has a fever, and that goes for the adult dogs as well, you definitely want to make sure you have it checked out.
Right.
Right. So I'm not saying that, but
Yeah.
I think that, as what I see in pet parents is that they freak out, and then as a result, the vets will be more likely to give them an antibiotic or a metronidazole or a drug because of how freaked out, the pet parent is.
Right.
Rather than maybe say, well, let's see, your animal is still doing okay. Let's just see how things go, and maybe in a couple of days, if it doesn't improve, or in a day, or if anything worsens, then we can still go to that. But the thing is too that oftentimes they don't want to come back.
Yeah.
The pet parents, because of cost or whatever it may be. So it's always easier to just give them a piece of candy, right?
Yeah. Yeah.
But I think as pet parents, you also have to, take a deep breath once in a while, and then, help your vet by asking the question, well, is there something that we can do without going for the drugs right away? How can I support my animal's gut? And there's more, happening. There's a lot more veterinarians now that are doing fecal transplants, even in the conventional world. So there's definitely more of that, going on. There's definitely more awareness that's, coming up with that subject.
Right.
So I actually have a question. As a pet parent who's dealt with exactly what you're describing, and watched the effect on especially my older dog when he started having a lot of problems, started with the medication and it just as a side effect, and I think it really led him kind of down a bad path. For those of us when we do see that our animal has started kind of going down this path of these types of problems, the bone broth is something I've tried, pumpkin, things like, what can we do though as a more long-term game plan to help that microbiome grow? I have a rabbit poopaholic in my house. So it's delightful. So it's like the walks are always like pulling the dog away from the poop, but and everybody laughs. But it is what it is, and I know why she's doing it, and maybe it's just delicious. I don't know. But so what can we do other than a fecal transplant, or my dog doesn't eat dog poop, only rabbit poop. So what are some of the things we can do?
Well, you have to start out with finding out what is causing it, what the issue is, because, I can give you all sorts of things that you can do, but unless we know what's going on, nothing of that, some of it may work, some of it may not work. So let's just look at it, for example, with bone broth. If you're making bone broth from chicken, and your dog is sensitive to chicken, the bone broth is not going to help.
Okay.
Right.
And bone broth is also a bit higher in histamines. So if there's already an inflammatory issue going on in the gut, and they may be a little more sensitive to histamines, then that can make it worse.
Okay.
So you have to kind of figure out first what's causing it and what's going on. So I always start out with testing.
Okay.
So some of the tests that I will run is obviously blood work, because I want to see if there's anything else going on that needs to be ruled out. I want to know what the pancreas is doing, what the liver is doing, etc., just to see. And also see if, how severe the issue is, if they're having some blood loss going on continuously, if their protein level is too low, because that gives me a bit of information on, how, severe the issue may be. And what I need to look at. I also like to check vitamin B12 and folate, because that gives me a bit of an indication of microbial imbalance as well. And then what I like to do is I like to check for food sensitivities, and I use NutriScan from Hemopet. It's a saliva test that gives me information on what foods they may be sensitive to.
That's my favorite one too. I love.
Yeah,
it's
a sensitive test. It's not perfect. No test ever is. But for example, if a dog if the test results come back with a dog being sensitive to everything, then I know it's more of a leaky gut type of issue. Not that it isn't leaky gut in other cases. I mean, anytime there's something going on with the GI tract, there is leaky gut, period. But if they only come back sensitive to a few things, then I know it's probably more actual food sensitivities that, the immune system is responding to particular proteins, for example, versus, if they're sensitive to everything, then it's probably not so much what they eat, but just the state of the GI tract that is causing it, So anyways, I like that. And then I also like the microbiome testing from Animal Biome, because that gives me some information on what the, microbiome looks like. And some of the dogs that I've seen, they have like 3 or 4 different families of microbes instead of multiple ones.
Right.
Because the gut of a dog and a cat has somewhere between 300 and 1,000 different species of microbes, and that includes viruses, bacteria, fungi, more parasitic, microbes as well. And some of these cases, they only have like a few, and I'm like, okay, they are missing like a huge part of the microbiome, and oftentimes there's also an overgrowth of certain microbes that we then, need to address as well. So it gives me a good idea of how to treat the microbiome, and if I need to add more things, to the treatment plan, and not just a fecal transplant.
So let me just help.
Yeah. So testing is important.
I'm going to help our listeners a little bit and just back up a little bit. So the microbiome, when she's talking about that, is our ecosystem in our gut that we're specifically talking about. You have a microbiome all over in different parts of your body, but we're talking about your microbiome, which is the diversity and what's going on in your gut. And so when she's saying disrupted microbiome, she's talking about disturbing the bacteria in your gut. And the test that Dr. Suter is talking about is from a company called Microbiome. You can actually get, Animal Biome, sorry, you can actually get it online, but you're gonna want somebody who knows, like Dr. Suter, to go over it with you. You can actually call the company too, but you can get it online, and it'll test how much diversity is in your pet's gut. And that's what she's talking about when she's talking about doing that test. To see, I've personally done that on several of our clients at work to see, what's going on. We found all sorts of weird stuff in the gut that shouldn't be there, because diversity is what we want, right? So if you don't have diversity, then what happens is it allows for bad bacteria to come in because it's an opportunist, or yeast, right? If you don't have enough bacteria to take up that space, we get poor stuff that comes in there. And that's why those tests are so important. We can see what our diversity, what the gut looks like it's different than doing, sometimes people will say, oh no, my vet ran a test, she doesn't have worms. That's not what we're talking about. It's not a worming test. It's a gut microbiome test. So I just wanted to clarify that.
And you had me do that with Peppa.
Yeah.
Because my little dog is one of these she's a little mutt of some sort, like Shih Tzu poodle, and it's just ear infections, and her fur was falling out, and she was miserable.
Yeah.
And you had me do that
That test,
and it was 66% of one microbe, and almost the others, everything else was just a tiny amount.
Yeah.
It was shocking, and it really made me kind of double down on doing a raw diet and some of the things that Carrie had been telling me to do, and she's doing better. So it proved, for me, I needed the eye opener, because you kept telling me.
I think a lot of times for people, just seeing that on paper, right? When your clients probably they see it on paper and they're like, oh my God, my dog doesn't have any gut bacteria. Yeah. And that can lead to, sometimes people think, oh, my dog just has IBD, I just feed him chicken and rice for the rest of his diet, or for the rest of his life, which is only still just maintaining it, right? This IBD can lead to some, not that IBD alone isn't serious, but it can lead to some very serious problems, right? If your gut is not absorbing and doing what it's supposed to be doing, what are some of the things you see IBD lead to?
Well, certainly malnutrition. Oftentimes we have allergies that go along with that. In cats, oftentimes they end up, it can be a precursor to lymphoma, intestinal lymphoma. So there are a lot of things that we see, down the road, and obviously a decrease in quality of life, dementia, because anytime we have inflammation in the GI tract, we have inflammation everywhere else.
Right.
Because when there's inflammation in the gastrointestinal tract, the cells that are lining the tube basically on the inside, they start to kind of spread out a little bit, and particles can go through these holes, and we call that leaky gut basically. So when we have leaky gut going on, we have particles that are too big and not properly digested that go directly into the bloodstream from the GI tract. And the immune system doesn't really like that. These particles aren't supposed to be there. So anytime you have these particles floating around everywhere in the bloodstream, the immune system will go and attack it. And what happens when the immune system attacks things?
Right.
We have inflammation, right? So it will cause inflammation in the brain. It will cause inflammation in the kidneys, the liver, the heart. I mean, everywhere.
Everywhere.
Basically, they end up with inflammation everywhere. And if this is going on chronically, it will destroy things. Because, inflammation is good. If you hit yourself somewhere, you definitely want to have inflammation there to heal. But once this, trauma is healed, then the inflammation goes away. But when we have chronic inflammation in the gastrointestinal tract, the inflammation never goes away. And these inflammatory chemicals, they will destroy things because they are also supposed to destroy whatever the trauma, the buildup was from the fibrin or, the swelling and everything. So they help to destroy that and remove things and clean it up. But if there's a constant removing and cleaning up going on, well, that's what's being removed and cleaned up. It's the tissues from the organs, and so that, creates a lot of issues down the road. So, as I mentioned, dementia, anxiety, aggression, kidney failure, pancreatitis, autoimmune issues.
Wow.
Because anytime we have particles that go into the system that look very similar to what the body is made of, then the body will go and attack itself.
Yeah.
So, for example, in humans, one very good example is gluten. So if gluten gets into the system unprocessed, what happens is the immune system will recognize the gluten and say, well, wait a minute, that looks just like the thyroid protein.
Huh.
So then it goes and attacks the thyroid. That's why a lot of people who have gluten sensitivity, they will have Hashimoto's, which is an autoimmune disease of the thyroid gland. So these particles that go into the system that are too big and not the right, not properly digested, they will end up creating changes in the immune system where it starts to attack itself. So autoimmune disease, and then obviously then down the road, any kind of immune dysregulation over time, like this, can end up in tumor growth, in cancer. So definitely not something that should be going on long term. That's why healing the gut is one of my top, priorities when I see an animal is, it's diet and fixing the gut, and I don't really do a whole lot else before that,
Right,
so
right.
That's kind of like the top thing, in my practice is like, we work on the diet, we figure out what the animal can and can't eat, because, a raw diet obviously is superior to many of the other diets. But for example, if I feed a dog raw, like a pre-made raw chicken food, and the dog is sensitive to chicken, then I'm basically throwing oil in the fire while trying to extinguish it. So that doesn't work. And that's why in these, chronic, GI cases, I often will do the food sensitivity test so that I can put them on a diet that will work while we are working on reducing the inflammation, fixing the microbiome, etc.
So fixing the microbiome, I know for me, a lot of people will call me because I do nutrition consultations. And then if I can find a good vet for them to work with, I'll work with the vet and the client. But I think my biggest struggle, and I want our listeners to understand that it doesn't fix overnight. And so I get people who get very frustrated and they give up and they say, forget it. How long do you think, and I know every pet is different, but for me, and I don't know if you would agree, I tell people, look, you could be in this for a long time, at least a year sometimes I have seen pets before we can get them kind of under control. And it's not a direct line. Sometimes we have to change and do something. What would you say to your clients? Like, how long do you think it would take to put invested into fixing the microbiome in the gut?
Well, it very much depends. I mean, I have cases where basically overnight they improve. So it doesn't have to take a year. If it takes that long, I would be concerned that something is being missed.
Yeah.
I remember the very first dog that I worked with, he had been diagnosed with IBD 2 years prior, and they had done food sensitivity testing. They had changed his diet accordingly. He was on a raw diet, and I mean, they were doing everything, and the dog still had diarrhea. And I remember I drove up there and did a fecal transplant on that dog. And the next day, his poop was almost normal. And over a period of a week, his stools completely normalized from that one fecal transplant. His energy level came back. His anxiety came way down because he was a very anxious dog. So I can, you know, if you do a fecal transplant and everything is prepared well ahead of time, this can go really quickly.
As far as the IBD, I guess I got off track a little bit because I deal with a lot of yeast. Trying to get the yeast out of the body, it takes time, I think, is more where I was talking about as far as balancing the gut microbiome when we're dealing with yeast infections.
Well, yeah, but how do you diagnose yeast infections?
Well, I'll get, like, if someone comes in and says, you know, my vet ran a culture and here's some yeast, and, you know, the yeast is all, or a biome test sometimes in the ears.
My dog's ears.
Yeah, those kind of things where they're having that chronic ear infections, chronic yeast and itchy, all of that kind of stuff.
Yeah. Well, that very often is a food sensitivity issue.
Yeah.
And fixing gut can, you know, turn it around pretty quickly. So it doesn't have to take a year.
Yeah.
Again, if it takes that long to make much progress, there's something else going on that needs to be figured out.
Okay.
You know, they may have a bit of a hormonal imbalance, things like that. But one thing that I often hear is like, oh, I put my dog on a raw diet and now he's detoxing. I'm like, sure, there's a little bit of detox, but if putting an animal on a different diet and the symptoms don't resolve and get better, there's something else going on. So I don't recommend waiting a whole year to kind of try to figure that out, because I think way too much is blamed on yeast and, you know, my dog smells yeasty or whatever. And, you know, I'm a bit on my soapbox right now, because oftentimes when anything skin or ear related is happening, or GI, everybody blames it on yeast. Yeah. I'm like, well, sure. I mean, yeast can be part of it, but, you know, we also have bacteria.
Sure.
We have, you know, parasites. We have all sorts of things. And again, yeast is more of a symptom that something is missing and not quite right. And so I'm not a big fan of chasing the yeast. I'm more looking at fixing the underlying issue, because yeast is everywhere. You know, yeast is part of the environment, is part of the GI tract, is part of the skin flora, it's part of everything. But why is it overgrowing? Why is it, you know, going, you know, crazy? Why are we seeing more of it? And if you fix the underlying issue, then, you know, that works much better than, you know, chasing it around. And one reason that we can also have yeast overgrowth can be toxicity. Because yeast and parasites, for example, what they do is they absorb some of the toxicity that we have in the system and then, you know, help us deal with it. So if we do have an overgrowth of something, then we also need to look at, well, what's going on toxicity-wise.
Right.
But definitely, anytime before we do any kind of detox, the gut has to be healthy. And the microbiome needs to be, you know, in a better shape, because otherwise the dog is not going to be, or cat is not going to be able to detox properly. It will just recycle whatever toxins.
So when you talk about fecal transplants, I definitely want to make sure our clients know you're not suggesting they just go eat random poop somewhere, correct? So
no.
Like
they do that anyway.
I mean, they'll do that, but we don't really want them just to be picking up poop at the dog park and saying that's okay, because they could pick up other things like, you know, worms and stuff like that.
Yeah,
so
definitely. When we do fecal transplants, I mean, those are poops that are tested.
Yeah.
For parasites and, you know, for good balance. The dog has to, you know, the donor dog has to be healthy. It has to be skinny. It has to be a happy dog, you know, with a good personality. I mean, there are a lot of requirements for a good donor dog. They should never have been on antibiotics or any sort of pain medication like non-steroidals.
Oh my
because
gosh,
that will affect
How's
the
that
microbiome.
possible?
That's got to be
Um,
hard for you to find.
Yeah, that's why I don't have a donor dog currently. I had one. He was extremely good. I mean, he was. I think when I started using him, he was about 12 years old. He had never been sick in his life.
Wow.
No antibiotics or anything like that. His poop was exceptional.
Yeah.
Unfortunately, he passed away since, and I haven't been able to find another one yet. I keep, you know, looking at the puppies that come, but the thing is that, you know, we live in a world that really doesn't promote good microbial diversity. I mean, we live in a world that uses a ton of glyphosate and chemicals and pesticides and antibiotics. So a lot of these puppies that come into this world, they already come in with a microbiome that's, you know, not very good, because for one, maybe mom was on antibiotics because she had pyometra before, or some infection or mastitis or whatever it may have been, and she ate a food that's not very healthy, like some of these, you know, kibble types that also cause imbalances and that may have been loaded with glyphosate because there's corn in it, you know.
Right.
So there's so many things that already affect the microbiome, and so with each generation, the microbiomes are getting worse. And in humans, I can't remember the exact number, but we are so deficient in diversity.
Yeah.
In this country, it's just crazy, you know. We just don't have that diversity anymore that people have in, you know, who live in the Amazon rainforest, or, you know, these native people who still eat,
Sure. So,
you know, what is growing, and we over clean everything, you know. We're so sterilizing everything rather than having a little bit of dirt on your vegetables. I mean, nobody's gonna die of it. Obviously,
Right.
I don't like the grinding part on my teeth if I have sand.
Oh my
But, you
goodness.
know, I have my own vegetable garden, so I just rinse it off barely,
yeah.
so that there's no obvious dirt on it.
Yeah.
But I keep it as clean as, you know,
As dirty as possible.
yeah, as dirty as possible. Yeah. And same with our animals. I mean, what do we do? I mean, every dog gets, you know, a bath every, I don't know, every week, every 2 weeks, every 4
I
weeks.
know.
So every time we rinse off whatever microbes they pick up from the outside, that they would then lick off of themselves and get into their system to aid in that microbiome, you know, maintenance, basically. And then we also feed them the same food day in and day out. I'm like, don't do that, you know. Don't keep them on the same kibble, you know, same protein, same brand for their entire lives. I mean, that's like eating Cheerios every day for the rest of your life.
Oh, it's heartbreaking. I see it all the time.
Same with over fermentation. I also see that as a problem. You know, there are foods that are out there that use fermentation. And so then people use all fermented foods constantly, like everything is fermented. I'm like, well, you can cause an imbalance that way as well. So variety is key, you know, feeding them, you know, different brands, different proteins, you know, just feeding a lot of variety to keep them healthy to begin with.
Right.
Obviously, once we have a dog with IBD, it's a bit of a different story. But,
sure. Yeah, we have,
you
that's the issue is I tell people with their puppies, you know, start them out now, getting them to eat diversity, because then if they become with IBD, then, you know, nobody wants to change their food because one little tiny treat causes the whole uproar in the house. And so it's difficult to get people. So I always tell people with puppies, and then with older dogs, let's get their tummy balanced so we can do rotation diet. But if we can't, we can't take our dogs to the dog park to eat poop, and we're having trouble with vets, not all veterinarians in everybody's area. This is heard all over the country and the world, actually, thank you to our supporters. But how do we do a fecal transplant then if we can't get our vets to do the fecal transplant? I know I've seen you on video where you stick a tube actually up into, and we inject in. That's one way, but we have to have a donor. Are there other ways we can get fecal transplants for our dogs?
There are fecal capsules as well. So there are two companies that I'm aware of that sell fecal capsules to be given to the animals. So one of them would be Animal Biome. Again, they have capsules, and then Mainstream Animal Hospital in Massachusetts, Dr. Margot Roman, she also sells capsules that can be given orally to the animals. So it's an oral fecal transplant.
Awesome.
That answered my next question. So I was going to ask you about that because it's something with my own, I've one of these, I'm a multiple food allergy person, so I, over life, learned using the right probiotics and things were really life-altering for me in terms of avoiding things like EpiPens and the problems I was having to deal with. But I, with my dog, I just had an elderly dog that had dementia. Your book, really, I read your book this week, and it really hit home.
We're going to talk about this real soon here.
I read it. It was hard because I had this dog that I'd brought in from who used to live out in the desert with my dad, and he came into my condo, and my dad couldn't take care of him anymore. But he was also almost geriatric when I got him. He was 10 or 11 years old already. And I watched him deteriorate, and I watched him get dementia. And with a parent with dementia, watching my dog going through it was just really hard because they're suffering. And so reading it, and my other dog has separation anxiety, so I'm like, oh gosh, people do say it's the owner. Oh well. But when I was reading the book, you started talking about all the kind of that mind-gut connection. And so I actually was really curious other than trying to get that microbiome better, do you have any other recommendations for someone who is, with dementia, it's kind of a little bit not too late, but a little bit, but with like my dog with separation anxiety, because obviously we know there's a connection. Any recommendations, any thoughts?
Well, it always depends a little bit on where it's coming from as well. Yeah. If you have a dog that had trauma and, separation anxiety from that, where they never really felt safe. I think a lot of the puppies, they get ripped out of their life, of what they know, and basically the rug is pulled from underneath their feet, basically. If they never get over that trauma, then we need to work with that, to make them feel safe. And there's definitely things that can be done nutritionally, but there's also people who specialize in separation anxiety, and so they will help retrain the animal to, be able to handle the separation, gently. But one thing that my sister told me the other day, because she just got a puppy recently, and her puppy kind of follows her everywhere in the house. And they live in a smaller apartment. It's not even that big, but anytime somebody gets up, the puppy gets up too, rather than just sleeping and feeling, comfortable. And I said, well, you're going to have to start training him, to not be so anxious. And she said to me that, she was working with a trainer, and she said that the trainer told her that the animal needs to learn to be safe first before you can start separation.
Yeah.
Before you can work with that. So, we have to get them to feel safe.
Yeah.
Before we can do something.
And with rescue dogs, it's hard to know also what they went through. So I was just wondering if there's something in terms of, like, she's already on a raw diet, and that's made a huge difference. And I'm going to get another microbiome test. I'm really curious now.
To see if it's changed.
Yeah. Because I've seen a huge change in her health. Are there particular aspects of the microbiome that do impact their psychological state, or are there microbes that, in and out of balance, impact anxiety or lead to dementia and things like that? Or is there not research that much yet?
Well, they are working on it, and they're finding certain microbes are doing certain things. So I'm sure we're going to learn more about that. But overall, you just want to have a complete microbiome that's healthy, because they all support each other. It's not like there's just one microbe that's going to be super good, and then let's just feed them just that. It's kind of like in humans, you want to have a variety of humans or a variety of dogs. You don't want to have just one kind. That would be really boring, right? So same with the microbiome, you have to have a variety, and they all work together. They cooperate, they communicate with each other, and so it's important to kind of work on that. And I guess, if we're talking about communication, we do have a huge issue with communication in general, with interference with communication through electromagnetic radiation. So this electromagnetic radiation that we're all exposed to through Wi-Fi, through cell phone towers, through electrical appliances in the house, etc. All of these frequencies, they interfere with the frequencies of the body, including the microbiome, and cause the microbiome to not, the individual microbes to not communicate well with each other. And if there's a lack of communication in any organization, it's not working, right? I mean, if you have people in an organization fighting constantly, or everybody doing whatever they feel like doing, you're not going to have anything positive come out of that.
Wow.
Same with the microbiome. If it doesn't communicate, if microbes don't communicate with each other, and they don't communicate with the cells of the body, then we have disruption and issues.
Wow.
So that also can lead to more anxiety, because there's just constant energy that's not working well for an animal.
Oh, yeah.
Because for example, in city, the Earth itself has an electromagnetic frequency. Well, it's basically the frequency that's between the Earth crust and the ionosphere. So basically wherever we live. So this energy, this frequency is called, it's the Schumann wave, basically. And the frequency is about 7.8 hertz. And that's the same frequency that the brain uses, it's the same frequency of some of the brain waves that are more calming and relaxed and meditative and that sort of thing. So now if we bombard the body with electromagnetic radiation that's at a much higher frequency, then it's much harder for the brain to be able to relax and not anxious and such. And obviously it'd be a lot worse in areas such as cities, where there's basically, they can't even measure the Schumann resonance in the cities because of that overlay of all the other frequencies.
Wow.
That's really interesting.
It is.
That plays a huge role in the microbiome and mental ability, and we see so much anxiety these days.
I know, the anxiety is we're going to do an entire show on anxiety soon, because it's just out of control, and it's not something that I have, I've worked with animals now going on 38 years, and the anxieties are off the charts, and we never used to see that.
Yeah.
So there's a lot of changes. Dr. Suter, we are going to have to let you go, but before we do, I want to make sure, honestly, that all of our listeners, anyone out there, Dr. Suter wrote a book, and it's called What Your Vet Never Told You. So it's very interesting. It's really, to me, it's such a, it encompasses a lot, because I think a lot of times our veterinarians are very busy and they're trying to get us in and out the door. It's a business, and they're not telling us what we need in order to heal our pets. They're telling us what to do really quickly and get you out the door, which often leads us into worse situations. So I highly, highly recommend that our listeners get this book from Dr. Suter. On our show notes, we're going to have all of the information. But Dr. Suter, can you just tell our listeners real quick how they can contact you, and if you do consultations, and the best places for them to get the book, and just kind of let us know how they can reach out to you if they want to talk to you about the gut?
Yeah, sure. But may I add one more thing?
Yeah,
that
please
is
do.
important
Sure.
to the gut
Yeah.
before we do that. Another thing is the fact that we over-vaccinate our animals, because every time
Here,
we
ching, ching. Yes,
inject-
yes. I agree.
Sorry?
I said yes,
okay.
yes,
Well,
please.
Yeah, because every time we inject an animal with a vaccine, we stimulate the immune system in a way that it would not naturally be stimulated, because no, flu or other kind of, distemper or parvo would be coming through the muscle.
Right.
So every time we inject an animal with a vaccine, there's an overstimulation of the immune system. And what I see very frequently is that, the animals have an issue, be it allergies or any sort of, whatever immune dysfunction there may be, cancer, autoimmunity, allergies, IBD, and they continue to vaccinate. And I think that's a huge, huge problem, because we already have an immune system that's not functioning well, and then we keep injecting it with more vaccines and things that are, stimulating the immune system even more. And I think we need to be very careful with that. All of my patients that have IBD or any sort of immunologic issues, they get an exemption letter. It depends a little bit on your state. But I think we need to be really careful with the whole immunization of the animals and really keep it at a minimum. And there's a lot that can be done with that. And I write a little bit about it in the book, I believe. I haven't read it in a while. Miriam, you know better than I do. But
no, you have a section in there about it.
Yeah, so I have my book. It's available on Amazon. I also have a video series where I go into a lot more depth on each of the subjects that I touch on in the book, because the book is more just to give a bit of an idea of what it really takes to have a healthy animal and to create longevity. And I did write the book for my clients so that I can just give it to them at their first consultation, and they can read it, because there's no way I can give them all that information in like an hour or an hour and a half.
That's amazing that you give that to each one of your clients.
So it's my little gift to them. And then, my video series just goes into a lot more depth on each of these issues. And I also have a few hours on vaccines and a few hours on EMFs, and so very much in depth. And yes, I do consultations. I also do phone consults. And I'm in the Chicago area, and I can't remember what else you asked.
That's okay. I just, we'll have all of the numbers and everything in our show notes for our listeners so that they can contact you. I just wanted to make sure that they knew they could reach out to you even in a phone consultation if we have listeners outside of the Chicago area. What's the name of your clinic?
It's Peak Animal Health Center.
Yep.
Peak as in Mountain Peak, so Peak Health Animal Center.
So if you're in the Chicago area, that's where you want to go. Right?
Yeah.
Okay. Well, we're going to go ahead and wrap this up, and thank you so much for talking to us about IBD. It is such an important beginning stages of us getting our pets healthy. I can't thank you enough for being here, talking to our listeners. You're just such an inspiration, not just to someone who's not a veterinarian, but I hope you're an inspiration to other veterinarians who are looking towards changing the way that our conventional medicines are being taught and used on our animals. So please keep doing your fight, because it is making a difference. I've seen it. Your name is getting out there as much as I see it all the time. So you're just such a blessing to us pet lovers, right, Miriam?
Absolutely. Thank you so much.
Thank you so much. Have a wonderful day.
Well, thank you so much as well. And I just want to say that, we are a community where, everybody does their part. I can just put out the information, but it's, pet parents that spread it and use it. So, we're all very, very important ingredients in that soup.
In our little microbiome.
So thanks for what you do.
Thank you very much. Take care.
You too.
Bye.
Bye.
All right. Thank you all so much for listening to the Spawdcast. Make sure that you follow us on both our YouTube channel as well as our Facebook page so you can get updates constantly, so that you can be introduced to doctors like Dr. Suter and some of the fabulous vets that we have come on here. We can't thank you guys enough for continuing to follow us. If you are, please make sure you share it and like us everywhere, so that we can continue to help with our co-hosts getting these pets to live happier, healthier lives. Thank you.